why do I use robotic-assisted technology for joint replacements? This is a question that I'm asked very often from patients, and that why have we, or myself, transformed into using robotic systems for hip and knee replacement surgery. I'm a high-volume surgeon. I have over 18 years of experience as a consultant, and I do over 500 joints a year, which puts me into the top 5 centile of the country. I've carried out over 5,000 joints. Now, if you look at the patient-related outcomes on the National Joint Registry, our outcomes for our surgery in hip replacement surgery are higher than most surgeons in Britain. We're a positive outlier. So minimally invasive surgery has excellent outcomes. Hip knee replacement surgery has also very good outcomes, similar to everybody else. But what we found is that knee replacement surgery for most surgeons has a 20% dissatisfaction rate. So 80% of people will do very well. 20% of people will have a degree of dissatisfaction. Now 15% of that group may be slightly painful, might be slightly stiff, and the other 5% may have a bigger problem. And this is one of the reasons we've gone to the technology, because we believe that one of the advantages we have is we can fine-tune. We're looking at small improvements which give bigger improvements to satisfaction. We're now fine-tuning that surgery uniquely for patients' anatomy. We're trying to improve ourselves in positioning those implants. We're trying to minimize soft tissue damage, and maybe those satisfaction rates will increase as we do that. When we started this journey 2 years ago, we had done no cases. We've now done over 400 cases, and we've been looking at the results, and ultimately the results of joint replacement surgery are clearly visible at 2 weeks when the patients return. If the patients are returning happy, the pain is controlled, and they're mobilizing with minimal crutches, then you know that that's a good outcome. And combined with the x-rays, which are showing better implant positioning, we feel that this is the gold standard, and we've been very, very encouraged with the results and the outcomes that we've had at this stage. Next talk. I've adopted joint replacement surgery because I believe it improves accuracy of implant positioning. Now, there are some surgeons who will say to you, well, I don't need a robot, I can position the implant very accurately. They may well be able to, but the jigs that you normally use for the manual systems are one size fits all. They only allow certain corrections. There's errors in fixation, there's errors in the saw blades, and therefore no matter how skilled you feel that you're as a surgeon, you are going to get errors. What we believe is that one size fits all strategy doesn't apply to joint replacement surgery. The surgery should be bespoke. And we always, use the analogy that what would be the most perfect joint replacement? The most perfect joint replacement would be a joint replacement that was positioned in your body with minimal soft tissue damage, minimal inflammation, and it was positioned exactly where your muscles and ligaments are tensioned and would give you the range of motion that you're used to. Now, unfortunately, we can't do surgery with no invasive intervention, and therefore the next best thing is to try to use the technology to position those joint replacements which are unique for you. So we can optimize the positioning. We're going to reduce the soft tissue swelling. We're going to reduce the imbalance in the muscles. We're going to improve the tension in the ligaments. And I believe those are the structures which cause pain, swelling, and dissatisfaction in these joint replacements. The technology is available for everybody. We've endorsed it. We believe it's improved our outcomes. We believe there's no detriment to the technology. It should be used with the surgical expertise. The technology is not a replacement for the surgeon. The surgeon still will do the operation. The surgeon will make the final adjustments, but it's an adjuvant. It's a very, very useful guide, both pre and intraoperatively and post-operatively. And therefore, we strongly endorse the technology. It can only be beneficial to patients. There is no 100% satisfaction after joint replacement surgery. It's about 90% after hip replacement surgery, 80% after knee replacement surgery. So what we're trying to do is improve those margins. It's small gains by improving accuracy, improving our surgical techniques, improving our perioperative pain management. We're trying to improve those satisfaction rates. And the results we're seeing are very encouraging. And we're endorsing this technology, and we're recommending now for our patients going forward. Thank you.